This format of live virtual workshops has been excellent recently. You know, out of COVID comes innovation, and here we are running all types of virtual workshops. I just think they're a really great way to connect, and they're very easy for you guys to participate in the middle of your days. So thank you for allocating some time to join us today. The Surgitron is what we're going to be talking about today. This has to be the most beloved, the most popular, the most well-known, and the longest-serving medical aesthetic device in Cynosure's history. And it's certainly the most loved by so many doctors here in Australia. And what we thought we'd do is get some of you guys together today on the line who actually own Surgitrons and who are interested in learning more about your Surgitron, but also for people who are interested in exploring it for their business. It's interesting from my perspective. It's a no-brainer for any doctor, any surgical doctor, and certainly any surgical doctor who's looking at doing aesthetic medicine as well. So we're going to tell you all about it today, and we're very lucky to have Dr. Ben Chan join us today. Ben, how are you today?
I'm pretty good. We just finished lockdown last week, so we're all busy.
Yes, absolutely. It's been an interesting time. So what did you do over the last 4 months?
Prepare more lessons.
Yeah, yeah. So you've got a series of GP super clinics in Melbourne, and you've also got a set of cosmetic businesses. Can you tell us a bit more about that?
The GP clinic in Australia, I know that we have to have other people joining us in this talk from other countries, is that they are very, very, very busy GP clinics. They see over a few thousand patients a week. It has sailed through the COVID period. It still functioned as normal with precautions. And of course, the cosmetic clinics were all closed, all 5, 6 of them, all closed. Oh, except the one in Adelaide still opening. So we had zero revenue, and we have to sail through this quite difficult times. If you look at them as a separate entities, they're quite difficult because there's no income and the staff have to go on furlough and so on.
And so what happened this week? Because you've reopened this week. Is it just full? Is every consultation spot full?
Yes, the nurses and the therapists are all full. We have a backlog. We have to go through the wait list that we accumulated over the 2 months of lockdown. So
yeah, sure.
Them.
And what are people getting? What are the most popular procedures in your aesthetics clinic?
Facials, toxins, fillers, lifts, and
Yeah.
Because we are such a comprehensive cosmetic clinic, and we are also medical, which we're going to talk about Surgitron. This is not your usual, like aesthetic skin clinic that you can, whereas Surgitron is what we're talking about today. This is another level for dermatologists, for doctors who want to get into skin clinic. It's not this, like how we got into this talk, is Surgitron is not something for beauty spa. It is a lot very medical, very dermatological. So whereas Skin Tech, my clinic run from very low end like facials right up to very like dermatological surgical. So this is why we're busy, because we're treating difficult conditions like melasma, acne scars, cosmetic mole removal, and so on.
Yeah, great. And there's something else you do too, though. You've got your aesthetic businesses and your GP clinics, but you've also got a training institution. Can you tell us a bit more about that?
This is now the golden standard. I set up with a vision that this has to be the world-class training center. So there's workshops we perform all over Australia, mainly in Sydney and Melbourne, because that's where the biggest demand is. These are the hands-on workshop. So briefly, you can see that the injections workshop, we believe we are the only one that is organized this way. I'm sure there are still some universities organize it that way, where we have the beginning from the chin filler step by step right up to cadaver. So it's a step-by-step progression. We think it is necessary to have that sort of experience and don't have somebody injecting the temple within a year of starting injection. And then, of course, to put it all together is a cadaver workshop that we run in Sydney and also in Malaysia, and we're supposed to run in India. This is very this is very, very hands-on and.
Sorry, I missed what you said. Just to confirm.
You got your GPS running.
My silly iWatch.
Oh, right.
So, so this is a very progress. This is just one part of injection. We are serious, and we have our own online anatomy for injectors that is UK and also USA accredited. But and I'm also starting another skin series because we're teaching people in Cambodia, Indonesia. They have no idea about how to start up a skin clinic. I just finished the first module today. Is about what equipment you need, how to start up, and gradually leading them through it. And the online, of course, is like you can so many modules, so you can learn. We are already in US, UK. We are UK CPD accredited. We are also Australian ACREM accredited. So we are growing in this. It's all about education. So these are accreditation. So for me, this is my job every day. I'm a 24-hour educator.
Great. And I think that's a really wonderful addition to a session like this, is to have not only a practitioner and someone who's used a Surgitron for a long, long time, but someone who's also very invested in education and really has a passion for it. So thanks, Ben. Guys, everyone out there, if you want to convert this session into a workshop rather than a presentation, we're happy to do either for you, but it works best if you interact with us. Especially on the Surgitron, and especially because there's a few people on this call who actually own them and are looking to learn a bit more from it. So we've got some stuff we're going to take you through today. We're going to take you through the more common procedures you can do with a Surgitron, and then we'll show you some additional surgeries that you can do. But the best way to interact with us is to use the meeting chat icon up the top. I've got a chat page running at the moment on my screen, and I can feed the questions into the discussion. So this works really well, guys. Don't be afraid. Even if you want to start now and you want to write something around what you hope to achieve or get out of this session, please chuck it in there and it'll keep the conversation running as we move through our presentation for you. So please use the meeting chat icon, pop some questions in, and we'll make it as interactive as possible. So Dr. Ben Chan, how long have you owned a Surgitron?
Oh, nearly 20 years. And look, I'm excited about this machine. Look, I don't get kickback. There's a disclosure. I don't get paid. I don't get any freebies. So I need to really introduce this machine. And I've been talking about this machine for so long because there simply is no replacement for certain things that we do. And my job is an educator and I want to spread the knowledge, and yet this machine is so little known. As you know, I also introduced you to the plastics to use this probably in the hospital because there is no replacement. There's just no replacement.
I know.
Machine.
It actually makes it quite easy for me as a supplier. My name's Christian Bell, by the way. I work at Cynosure, and I've had the Elman Surgitron for about 7 years. Cynosure acquired the company Elman about 7 years ago, and this product fell under my banner. And I must say, from the day one, I realized from talking to doctors how much they love the device and all the versatility of what you can do with it. So, Dr. Chan, talk us through these tips here. What do they do, and what's the difference between cutting with one of these versus cutting with a scalpel?
Okay, another thing that I would like the doctors to know is that, since I've just a little bit offshoot, is that this machine is stable and there's no servicing. It has never broken down in all the years I've had it. We do transport it, that little thing up there, the top one. So we do transport it from clinic to clinic, and it is portable, and it's never broken down. It's just a very stable machine. When we talk about cutting now, of course you can use a scalpel, right? That's why I introduced you to the plastics as well. It is unique, and when you ask me about the tip is the slide before, which is the one with in the previous slide, you have a lot of tips. Is that the one? No, you haven't got it yet. The little wire, just a wire.
This one on the end, the Varatip.
Oh yeah, that's the one. Sorry, my
yes.
God. The Varatip. That is a tip that I use. Well, most people use that as a cutting tool. So it is like a scalpel, but it's very different from a scalpel in the sense that you have a tip there, and when you touch the tissue, it just opens up like the Red Sea. It just parts. And it parts very nicely. There's no pressure. As soon as you touch the tissue, it just breaks open. And why I like that one is because of the precision. You can see it's a little tip. I can precisely control. If I draw a flat or a marking, elliptical marking, I can precisely run this along that line at the pace I like, and as I draw along, and the tissue just parts. So I can cut precisely according to the flap I designed, not like a knife. I can't really curve it around and it'll be a little bit out. This one is so precise because it's a wire tip, and it just runs along the design, whether you do a flap or you do an excision according to your design. So precision is number one. Okay. And number two is, as it cuts, it also coagulates as well. So all these tiny arterioles, venules, it basically just stops the. This is not quite it.
Yeah. I thought
Yeah.
we do have an incision that I'll show in a little while. Would you, maybe we can skip to that if we're talking about incisions.
Okay, so that one, the third thing about it is, you remember I talked about the precision, and then the secondly is the coagulation. Here it is. I think this is my job. So if you can see, you can basically trace where you want it. In this case, I trace it within the black line. So you can see how precise it is. That power turned up a bit more. That's why it sparks. And now this is the key. You can see as it cuts, it coagulates. Now, this is very, very important in an area I'll address. Number three is, you can see when I cut it, I can precisely control the depth of where I cut it. So you can't do it with a scalpel. You're actually cutting blind with a scalpel. This one, I can see in the corner there, see, I can precisely take it out. Whereas if you have a scalpel, you actually don't know where the blade is because it's not so precise. This is what I mean by precision. And it does coagulate it as well. And I think your new Surgitron has a coagulation thing. Oh, by the way, we used to be called Cosmetic Institute of Australia, now it's ASI. Now, I will tell you why this is so useful, precision. For people who do upper blephs or lower bleph, a scalpel just cannot cut it. You use a 11 blade, you just don't have that precision, and your skin may move, your skin laxity may move, right? You watch this, the skin doesn't move. If you put a scalpel in, your scalpel is going to be like pushing left and right, and deep, and that's a problem because the skin moves. You can see the skin doesn't move at all. That's how precise it is. So it is this reason why one would use Surgitron. Look, this is like a Rolls Royce, and once you use this as a cutting machine, there's no replacement. You won't go back to scalpel again. Now, another place where I'll use it is in the scalp. Anytime you will need to cut the scalp lesion, because you know how vascular the scalp is, this one coagulate in the meantime. I think you may have a tip that coagulate at the same time, so that you have less of assistance, right? Otherwise, you have a nurse pressing on the bleeding area, you got gauze flying everywhere. So there is no way I can do a scalp excision without this machine, because it's just going to be bloody and takes twice the amount of time. So let's recap. Is the precision, especially in the bleph area or whatever other areas where the skin doesn't move, it just glides along, and in the scalp. So that's a summary.
Excellent. And that's just really covering one tip and one type of procedure you can do with the Surgitron using the wire tip or the Vara tip to do an incision. And it really is tensionless. So when the needle interacts with the tissue, it just moves through it. It just splits the tissue like a hot knife through butter. And I'll talk about the science of that in a little while. Here's the most common thing you can do with a Surgitron, and this is by far the number one reason that doctors buy their Surgitron. Typically, if they're a cosmetic doctor and they're using it purely for their cosmetic businesses, then they're using it for cosmetic mole removals. As we've just talked about, it can be used for general surgery. It's also used by vets and plastics and derms and all types. Anyone who's doing any type of surgery will get a benefit from the Surgitron because of its precision, because of its tensionless application on tissue, and its ability to coagulate simultaneously. So let's go into, the main reason people buy their Surgitrons and use it, which is cosmetic mole removal. Ben, Dr. Chan, can you tell me a little bit about this patient and how you achieved this outcome?
Okay, this is what we specialize in. So it's a cosmetic mole removal. The uglier the mole, the bigger the mole, the easier it is a job. How? If you think about buying this machine, you need to communicate with me. You need to learn about the Surgitron online. We have that module. And also you need to learn how to do cosmetic mole removal properly. But most patients are like this. These are intradermal moles, and you have these are intradermal moles are the easiest type to remove with this machine. Can I comment that if you want to do this sort of intradermal mole removal, there's no other machine, I'm afraid. You can't do it with a laser. You can't. If you do it with a shaving knife, you're never going to complete the job. There's only one way. You can only use Surgitron. There's no other way you can do it. No other way. So this is one showing. Now we do it slightly differently. This is a total ablative technique using the same tip. If we are doing in Australia, or medical thing, so we do ask you to shave biopsy first. So you know what it is. This is simple ablation. This is intradermal. You can ablate it. Basically, this is what you do. But we'd like you to shave first before you use this. That's what I'm saying. So that you have a pathology and to back up. So let's assume this is where we are now. You have shaved it. You send it off. So you still have a thickened base. This is how you remove the remnant of the mole with this machine. You can't do it with anything else. I'm not aware that you can look in our clinics and my teaching. We have CO2 machine, we've got early lasers, we have everything. You can't remove a mole without this machine.
A lot of clinics advertise that they do cosmetic mole removal with lasers. What's your experience there, and why are they choosing to use a laser?
They need to come to my training.
Yeah.
Yeah. Or I see the after unhappy patients, which I see a lot.
And scientifically, it's because you're generating too much heat with the laser. Yeah, you're spreading the heat beyond the lesion itself, and therefore affecting the surrounding tissue and creating more chance of a scar.
No, that's not the main issue. The main issue is that remember, intradermal mole, they can be raised about 3 to 4 millimeters. And you can't, you keep doing ablative lasers, you can only remove microns. You can't remove 3 or 4 millimeters. You can't do that. The lasers can't do it. You can cut it with a CO2 laser, but you can't, with laser, remember it's a beam of light. You may control exactly where you want it, but you can't control the depth. And you can see how accurate this Surgitron is. You can control the depth. And if you push not enough, then the mole is still going to be there. If you push too deep with a laser, you're going to end up with scar. So you're going to be an unhappy patient. You basically have no control not as precise with a laser. So look, I don't recommend. We have all sorts of machine. You don't control that because it's a beam. Remember, a CO2 laser is a beam. You shoot it in, but how do you know what depth you can? Whereas this one is a tip. And the other thing I want to mention is that have I removed skin of all skin type? Yes, 1 to 5. Okay, we haven't seen the African Americans, they skin type 6. I haven't seen many moles in them, and luckily I haven't been asked to remove anything because they do keloid. But have I removed patient skin type 5 like Asian, South Asian, Indians? Yes, of course, they don't scar. You can see with intradermal mole is that it's got to do with the pathology. It's got to do, most of the mole cells are actually in the dermis, and this one cleans it up completely.
Great. And so, I often hear from doctors when I introduce them to the Surgitron and I explain what it can do, they tell me that they own a hyfricator and they're really good at whipping these things off with hyfricators. So what would you say to a doctor who just perhaps doesn't understand the difference between a Surgitron and a hyfricator?
Hyfricator is okay for a GP clinic. We have that. Okay, it's not good. But to be finesse, to be achieve that degree of expertise, that degree of finesse, and it's chalk and cheese. You can't use hyfricator in a cosmetic clinic because the reason they come to you is because they don't want scars. They don't want to have that. If you use a hyfricator, I understand this frequency is a lot higher. The main thing is the heat. Surgitron doesn't generate the heat. So once you're heat, if you understand the skin size at all, the heat will penetrate sideways and deep. And if you go through the dermis, we call the appendages, which is the follicles. If you heat it that much, then it creates a scar. You create that guaranteed to have a scar with hyfricator, but you can see how precise this one is.
Yes.
It just using a loop to dissect it under, and then you clean it up. That's another thing I'll use. So yeah, this is what you do. So you remove it very quickly, and honestly, it's 95% gone. And then you touch it up with this one just to make sure that the residue of the lesion is gone, and you use that tip to stop the bleeding as well. So the patient goes back. Look, the lesion is almost 100% gone, right? And the patient is absolutely happy with that. You can have a look at the way that the operator uses it. Is a touch. There's no pressure. It's a touch. It's a very light touch of skimming across, because as it goes across, it removes the tissue, remnant tissue. So it's no deep cutting. It's just a very light touch. So you don't penetrate the dermis at all, and so the patient ends up with no scars. And this is what we use for mole removal. It's supposed to be no scar.
And the tip choice you're using, we just saw in the previous video, it was almost like a blunt end. It's called a pin tip. It's very popular with the Surgitron because it doesn't cut. It doesn't produce an incision. It's blunt, so it's able to simply ablate from top down. When would you use a loop versus a blunt tip like the pin or the broad needle that we're seeing now?
Okay, the broad pin now, as you mentioned it, is you can just use it as a touch-up because whatever is at the end of that is being ablated anyway. I use this mainly, you can use this as a touch-up, but I like the loop because I can see it's finer. They're both cutting in the sense. I use this loop, this piece of equipment here specifically in xanthelasmas and syringomas. And I don't know whether we have a video for it. And I have always advocated, if you're ever going to treat a xanthelasma or syringomas, it's never with a laser. Same principle goes. Why not the laser? Because you can't control the depth. You don't know how deep the laser is going. And the lasers don't go in that deep anyway, and even if it's CO2. So you do need to touch it and just touch it and touch it until you get the right, this might be, yeah. So you can see there's no scar, right? There may be a pine pits, but there's not a scar. So it should be minimal scar. I wouldn't say no scar. Yeah, most of mine have no scars at all. But
and what are your options here? If you wanted to do this and you didn't have a Surgitron or a laser, what are your options here, and what are the likely outcomes if you use those alternative options?
Wait, you can't. You definitely cannot use hyfricator, not especially in Asian face, right? You're going to scar them. CO2, like I say, is no precision, And if you use just a blade, you're going to have like 20% left behind. And I often see that when the patients have incomplete mole removal, when they come in, I see a bump. I've got no idea the bump whether it's still remnant of a scar or of a mole or a scar. I have that problem because it's half completed. Now this is when I use a loop. This is one of mine, and you just use anything and you just cut through, because this one I can still send it away for diagnosis because it's SEPK anyway, or sebaceous mole. This is if somebody has a sebaceous mole on the scalp, this is the equipment of choice. You can remove it, and yet you have enough to send for biopsy. So we are scooping it out, and this is SEPK. It's not a sebaceous nevus. You do the same thing with sebaceous nevus. There's absolutely no scar, and the patient, wow, it's so quick. How long did that take? Maybe 1 minute. So this is what I use to stop the bleeding as well. Look, it basically just coagulates everything. So with sebaceous mole on top of the scalp, that's what you use. So this is typically what we do. Look, this is so impressive. I mean, so this is a skill I would really like to transfer to especially those people who work in Asian countries. I know we got people from other countries joining us in this webinar. It is because this is so not known at all, not exposed.
Yeah. Yeah. And just on that note, we're talking about probably the most prolific treatment you're going to use your Surgitron for. If anyone's got any questions, please hit up the group chat. There's a little bubble icon along the top. You just click on that and type a question in, and I'll be able to feed that into the discussion. So please, I'm sure there's plenty of things going through your mind right now. If you use a Surgitron currently, you might have a question about tip choice or power or technique. And if you're looking to explore the Surgitron, you might be sitting there going, oh my God, how can I use this for treating a particular skin lesion? So please put it in there. And I've got one already. So Dr. Chan, can you treat keloids with a Surgitron?
Okay, keloid, when we treat keloid, we want to know whether it's an established keloid or it's a red keloid. When it's a red keloid, means the vessel is coming in and you're still growing. We can use this. We basically need to stop the growth. Okay, the white sort of keloid is just growing slower. The rest of red sort of keloid is just growing everywhere. So what traditionally happens is that you inject cortisone to slow down the growth. It doesn't mean that it doesn't recur. So you slow down the growth, and then you put silicone in to prevent the recurrence, right? If the keloid is very thick, it's not going to go away with just injection of cortisone, because it's too thick, it's too fibrous. So you basically have to remove it, and then you inject it. So yes, you can remove it, the thickness of it, and then you have to start cortisone. So is it going to make the scar worse? It's no different from doing the surgery to the scar. The patient will heal and just come back anyway. So the advantage of using this, it doesn't stop the keloid process, by the way, because a keloid is caused by the tension and genetic factors. It's a tension of the scar. So that's not going to go away, okay, because that's that person. And then the genetics, that person. So can you cure it? No, but you can use it. It's a very thick keloid, especially those earring bumps. They can go to plastic surgeon and cut it, and then they put a clamp on it. You can use a Surgitron to debase it, remove it, and then start injecting cortisone and put a clamp on. Yes, it is an application. That's what we use as well.
Great. And so tell me, when we saw this video just now of removing a SEBCA, so the patient comes in, wants this removed, and you want a biopsy as well. Are you billing Medicare for the biopsy and then charging privately for the cosmetic removal? How does that process work?
So the Medicare will be more or less for the biopsy and so on. Technically, you can't charge them privately, and so it's up to individual how they want to run it. You can't sort of we can charge them a facility fee. Look, I don't know what the legality is with the Medicare, so we don't charge them on Medicare. We just charge them privately as a lesion. That we just charge them $400. They can do whatever they want. But that has to be sent to pathology. No, we don't bill them another consultation on top of that, because we have done the consult before anyway.
Yeah. Okay. So the majority, like 90%, 99% of procedures done with a Surgitron are privately billed. Is that right?
Correct. There's no item number for it. We just charge them, like, for example, SEPK, if they want it removed quick and with an elegant technique. This is our specialty. It's not as if they can go to a GP and do that.
Yeah. Okay, so if you're wondering how you charge for these procedures, even if you do biopsy, it's all private billing, and the patient is paying for the lack of discomfort, the ease of the procedure, and of course the outcome being as scarless as possible to produce a cosmetic result. So that's what the patient is paying for. Can this work in a GP clinic? If you've got a GP clinic and you're not doing much cosmetic stuff, you're not doing injectables or other types of aesthetic procedures, can you start offering cosmetic mole removals and charging privately? Do you think that would work?
That's how I started.
Yeah.
That's how I started. And you just grow your expertise. Then later on you do xanthelasmas. Are we going to talk about xanthelasmas?
You can. I don't have any slides on that.
Say, for example, xanthelasmas, right? And syringomas. These are for dermatology, people who do dermatology or GPs who recognize what's the difference between syringomas and xanthelasma. Well, xanthelasma is easy and not amelia. So what are the options out there? It's not a lot. In the past, of course, well, not in the past, it's those people who are ill-informed, they use laser. Again, I come from laser, it's just a beam. You can't control the depth. And gone are the days that you cut out xanthelasmas, because if you get trained in the removal of xanthelasma, you get the skin, and then you got a layer of fat, and then underneath it is the orbicularis oculi. With a Surgitron, I'm sure I've got plenty of videos on my YouTube, on my module. You can precisely remove every tiny bit of fat deposit without overdoing it. With a knife, you can't do that. You have to stitch them up. With a xanthelasma, with a blunt probe, you can bit by bit dissolve it, and the patient has an open wound, and they heal without, even if they're Asians, they heal within about 5 to 7 days, and that gets closed without a scar, because you are not damaging anything else. So they all heal without a scar, because the crease and the eyelid creases anyway as you look up. And it is a fast procedure. It's just done under local. There's no cutting, and it's so precise. You can do several at the same time. Surgery, you're not going to cut it. It is a tiny bit, right? Whereas with this machine, you can do the whole lot all at once, cleanly, and without going to the hospital, without sutures. This is so elegant. And I keep saying that for xanthelasma, you really should not be doing anything else other than Surgitron, and so is the syringomas.
Okay. Excellent. So just out of interest here, if you're wondering how this works, it's easy to imagine that the tip of your Surgitron needle is red hot or incredibly sharp. And it's the heat or it's the sharpness of the tip that's doing the cutting, but it's not. It's actually very interesting the way radio waves work. So radio waves are emitted from the end of the tip, and they are projected into the tissue, and they're attracted to water cells. And when they hit those water cells, they turn them to vapor, and it dissects from the inside out. So when you watch this cut again, you can see that it's not so much the sharpness of the needle tip or the fact that radio frequency produces heat in the body. It's not that at all. In fact, it's when the tip touches the tissue, it's pushing the radio waves into the cell's water, and that water is vaporized, basically turning to steam and dissecting from the inside out. And that steam and that heat is also what gives you the nice coagulation. On your handpiece with your Surgitron, this is what it looks like. We've seen the tips, we've seen how they interact with the tissue, but the operator has a handpiece that looks like this, and there are 3 modes on that handpiece. There's a cut mode, there's a blend mode where you're cutting and coagulating, and there's also a cautery button or hemostasis, which is this blue button on the end here. So you've got cut on the top, blend in the middle, and hemostasis on the bottom. Can you tell me, Dr. Chan, when would you use a cut versus a blend versus a hemo?
Okay, you can, if it's a simple thing, you just use a cut. Otherwise, I use a cut and coag all at the same time if I'm removing a. Okay, let's go back. If I'm just doing a mole, I will use a cut. And if I'm doing a scalp excision, I know it's going to bleed a lot. So I'm going to, because it's past the dermis, the skin like even if you're cutting a skin excision, I'll use cut and correct. If they continue to bleed, then I'll just use a hemo to touch it up. So it's self-explanatory.
Yeah.
Any doctor that's doing skin, they will know immediately. They'll just adapt to it. We, of course, yeah, that's a old-fashioned one. That's what I use, to touch it and correct. So it can correct it. It's just like what you see in operating theater. So, you just pinch a vessel and it just seals the vessel off, so there's less bleeding. You need less assistance. You will see that a lot if you try to do scalp excisions, right? So they bleed a lot, so you just need that tip to stop the vessel from growing rather than just pressure.
Fantastic. So as you can see here, cautery forceps are also an accessory for your Surgitron. So while you're using your handpiece to do cutting or ablating, you can also simultaneously have your bipolar forceps plugged in. They're activated by a foot pedal. So if you were doing some skin cancer work, if you were doing some flaps or grafts and you were getting a little bit more bleeding from the incisions, you don't need to just rely on the coagulation ability of the tip. You can use these cautery forceps in conjunction with that. And so, this is a classic photo of mole removal with the Surgitron. And the reason I've put it up here is because when I first looked at this, I thought, oh, this is a company photo. This is too good to be true. This is a really lovely outcome. Is it embellished in any way? And then I was given this clinical article by Dr. Joe Nyamtu from the US. And this is almost like the, I guess, for lack of a better word, the Bible for operators of the Surgitron who want to learn how to do cosmetic mole removal perfectly. You would have this paper. Now, this paper is sitting in your email. I sent it to you yesterday. It's in a resources email. So if you want to review that and have a look about technique, power settings, tip choice, etc. All of this stuff is outlined in this clinical article, as well as, of course, this case. He goes into very big detail about how he attacked this and got the result that he did. So this is a really great way to sort of back this session up and do some further research yourself. It's in your email. So when it comes to charging for cosmetic mole removals, Dr. Chan, how do you do that?
Okay, because of what we've been doing for so long, and I don't think that you should charge that price until you reach my level of expertise. We charge one mole $800, so 2 mole will be $1,002. If it's like that guy who's got complete face, it's about $2,008. The price hasn't been changed for the last 15 years, so it's still that. Body, we can't really do cosmetic mole removal on body. Why? Because the skin thickness is completely different. So you can only use that as an excision. So we can't do cosmetic mole removal on the body. So it's just a simple excision. You just charge whatever you think you like.
Fair enough.
This guy will be $2,008.
Yeah, I mean, let's face it, 95% of all patients looking for aesthetic procedures are looking for them on the face, whether it's a surgical option or non-surgical. So when you look at this patient here, Dr. Chan, what did they pay, if you don't mind, ballpark, what did they pay for this procedure?
$2,008, because you forgot he's got some more moles on the right-hand side of the face. So,
okay.
You only see the left side.
Right.
So each mole is only a few seconds, so it's not as if each mole is going to take half an hour. So once you numb it, whether you do 3 or 4 moles, is fairly quick. Like you see the video, each mole is like 2 minutes.
Yeah.
So it's probably less for those small ones.
So if someone's prepped the patient and injected the anesthetic and got you all set up and you walked in, you might have taken 10 minutes to do this procedure and the charge would have been $2,800.
Yes.
Okay, great.
Yeah. But I have to do the numbing. The prep is not much prep at all. So you just numb it and then you walk away and then you come back and then setting up the machine, that's about it.
Yeah. So if we take a lesion like this, for example, I'll just skip to the end here. So At the end of our procedure, we've gotten to this point where it looks clean, it looks cauterized, it looks really nice. So what's the aftercare here? Do we need to put on any sort of cream or a bandage? How do you send the patient home?
Okay, you can see that the cautery itself is really formed a scab, so it replaces the stratum corneum or the epidermis as a protective layer. So that scab is going to fall off in this particular patient because it's Caucasian. It's going to fall off in about 5 days. But in the meantime, you want to, because it's a scab, the skin is healing from underneath, the epidermis is going to rebuild from underneath. You still want to keep it dry because you really don't want to soak that scab, and then you expose the new skin underneath to infection. So you just apply some form of antiseptic cream, whether it be Savlon or Bepanthen, and then you put a Band-Aid, that's it. So
Yeah.
keep the area dry for 5 to 7 days. And
Yeah,
then,
agreed. And another product that's used is the StrataMed product.
yes, StrataMed, yeah. If you expect keloid and so on, yeah, StrataMed is a very good result.
Yeah, yeah. So you just dab a bit of that on afterwards, and then what? You're telling the patient to, reapply that every 24 hours for a week or something. What's the send home message?
Okay, keep it dry and apply the cream twice a day. Antiseptic. StrataMed is not an antiseptic. StrataMed is a silicone-based gel, and that's if you think you're going to get a keloid, which you don't anyway. So you just apply. Look, I don't have any problem because StrataMed will also act as a repellent. Yeah, it's a sealant. So that's all. 5 days later, they can remove the Band-Aid. That's it.
And just going back to one of the points you made before about treating lesions on the body. So if you can have skin tags and SebKs on the body, that you can treat with the Surgitron almost cosmetically, because you're still removing the lesion and your aim is to produce as little scar as possible. And, the patient might have the same attachment to a lesion on their body as they do on their face, and they want that removed, and they want it removed with no scar. So to the patient, it's equally as important as a facial lesion. Why can't you treat intradermal nevi on the body?
First of all, there's no intradermal nevi on the body. They're usually compound mole or something else. So there's there's only simple mole, which is a compound mole, and intradermal mole. These are the 3 large groups. Simple mole, they sit on the epidermis. Compound mole, a bit more complicated. They will have a bit of pigmentation mole cells in the dermis, whereas intradermal mole is just push up, everything is on top. So we don't see those on the body, but what we see on the body, exactly like what you mentioned, is like neurofibromas, skin tags. Let's talk about skin tags. Those diabetic patients that come in with at least about 12 of them on one armpit. You give each one a local. Of course, you can use cautery, right? Because you're not going to worry about scars. But if you use this, what's the difference between this and cautery? It's nothing to do with the results, because both will get the result in that sense. But the cutting procedure is a lot faster with a Surgitron. It just glides through. Whereas with the diathermy, it's a lot harder. I can tell you that now. Because we use both. So those people with a bunch of papillomas, skin tag on the armpit, you just pull it up, it just glides through. It's like cutting butter, like you said. With the diathermy, there's a bit of pressure. It's just a process. It's not as elegant, but the result's going to be the same.
Okay. All right. Well, for the last 15 minutes, I thought we'd explore some of the other procedures that you can do with a Surgitron. We've talked about cosmetic mole removal, different types of lesions and xanthelasmas and SebKs and all types of lesions you can remove. We've talked about how you charge for these, and this being predominantly private billing procedures. And we've also talked about skin incisions. So I wanted to flick now to some other things you can do. So let's just check this out. I mean, I think if you've got a comprehensive aesthetics business and you've got an IPL or a laser, vascular laser, obviously you're going to be using those machines to coagulate telangiectasias. However, you can do it with a Surgitron. I mean, in what case do you still use a Surgitron for this, Dr. Chan?
Okay, so telangiectasis is usually due to skin damaged skin, and you can see that you require an instrument that's very pinpoint, and you can see the telangiectasis quite well. You know those red streaks quite well, and this is the equipment of choice, right? Would you fire laser? No, because the nose around the area is curved, and the cost of the laser doesn't justify this using this, right? This is quick, and by the time you turn the laser on, we're finished already, and the laser not even as accurate as this. But if the patient has a lot on the cheeks, then you may consider tracing them individually if they allow you, because there's so many, or you just use an IPL, right? And then leave the difficult ones, those remnant ones, with Surgitron. So you do the rest with IPL, and then these final ones, a bit thicker ones, you can't fix them with IPL. And yeah, you can use a laser, but like I say, why use a hammer to kill a fly? You know, this is so simple.
And I'm just sort of anticipating what people are thinking. Has this patient had any numbing?
You can put some numbing cream on.
Yeah. Okay. And
you won't inject them with that local anesthetic.
No. Okay. And price-wise, let's say you had a patient with a full nose or a chin or a cheek, and you were actually doing more than just this sort of one-off telangiectasia. How would you charge for it?
It's time-based, I think. We charge them like per block of time. We anticipate even there's no 2 minute, there's no 5 minute. We just charge them for 30 minutes. We do as much as we can, and usually one treatment is enough. It's about $300 for Australia, so that's how much we charge. And if they recur, it's another $300. You're not going to fix everything in one hit. Maybe sometimes they recur or you miss some spot. That's up for you to negotiate.
Yeah, and that's actually a good question. So, what's the rate of recurrence?
Rate of recurrence of facial telangiectasis is quite high.
Yeah.
So you can control for them 2 or 3 years, and then especially we are drinkers and sun exposed, they keep coming back. Whereas with the young ladies, it's just sun damaged ones, they don't need to come back for a few years.
Yeah. And how would you deal with a patient, say, who came in, had a treatment, you got rid of them all successfully, and then they returned, 6 months, 12 months later, and they'd come back, or a few of them had sparked up again, and she questioned your ability to have done the treatment in the first place. How would you handle that?
You should handle it at the beginning, at the consult. In the beginning, so you need to tell them there's recur, and it's not that your technique is good. It's because they've been sun damaged for so long. The skin is just fighting to show all these problems later on, and the patient continues to be in sun exposed and continue to age. So this is a cosmetic temporary measure. We can't cure them. We can't make them younger, that much younger. You just anti-age a little bit. And so it's a medical procedure. So you just deal with them at that time. So we're not trying to cure the problem, because veins are veins. They're like a traffic jam, right? If root is blocked, they'll find another way to come through. No different from varicose veins on the legs.
Sure. And so just in case you're interested, you're using the hemo button on your handpiece, and you can use any wire tip needle. So in this case, the same needle that can be used to do an incision can now be used to coagulate facial vessels, because you're not using the cut option. You're not using a mode on your Surgitron that will cut. Okay, it's designed, it sends a specific wave that's going to result in coagulation. So you just flick to your blue button, you turn it right down, so onto a power setting of 2 or 3, and then you're just literally dabbing across the facial vessel. Is there any extra medical legal coverage required? Like if you're a doctor and you're doing surgery, and maybe you're doing aesthetics as well, and you buy a Surgitron, is there any extra legal? Does it do anything to your insurance?
Not if it pertains just to what we talked about in this area, like using the Surgitron. There's not, because it is considered as a medical procedure rather than that's aesthetic procedure.
That's a perfect segue. So now let's look at a more significant procedure. We talked about it right at the start briefly, and that's an upper lid blepharoplasty. So, is this going to incur an insurance upgrade? There's so many questions. Who can do this? It would seem to me as though the skills of a skin cancer doctor would translate to this really easily. But can you talk to us about who can do this procedure, and what it means for their insurance?
Okay, if you are doing a medical blepharoplasty, not for cosmetic reason, it's still the same thing. But don't forget, before you get an expertise to try to cut this, it's not something that I would recommend that you can learn from the YouTube. I'm talking about upper bleph, because you really need to know your anatomy, just like we teach in Botox and fillers. We didn't see the end of the story of this. But if you are confident doing a lot of skin surgery, you know that the first layer we pass is the skin, epidermis and dermis, and then when you lift it up, it's just a dermis, right? It's just subcutaneous fat, and you need the subcutaneous. You're not. This is a very professional, specialized training on this one, and then you just stitch your skin together. So you're not touching the orbicularis oculi. So if you're confident in controlling that, then there's no issue. I used to do that only in Caucasian patients, not in Asian patients, because our skin is so much thicker and we don't heal so well. So you cannot afford to touch the orbicularis oculi. So you do need specialized training. But that brings us to the next point, Christian. We forgot to mention that there is a dot point blepharoplasty, which we don't have it on this one. And
no, we do. We got it.
Okay. Yeah. So this is not for severe blepharoplasty, and yet you can use this. You do need a bit of local anesthetic, yeah? So what is it trying to do? And this is a much safer bleph than the excision technique, and this is the technique, and you can charge $800 for this. We do that. It's a simple procedure. It's dot. So how is it blepharoplasty? Well, we don't technically it is sort of blepharoplasty, and it's not. It's more eye rejuvenation. You can see clearly. You must notice that this is a Caucasian patient. The skin is thinner, and when she closes the eye without stretching it, what you note, there you are. Where you notice is the fold, the skin fold. There's a lot of skin laxity, and that's the reason for this look. So all you try to do is to remove the excessive skin. Now, we do it by dot. Why? Because there's still normal skin in between, and this lady will heal within a matter of 5 to 7 days. Right? Next, there's not much stressing other than using the antiseptic and keep protecting the scar. The next morning she will swell for sure. That will be the worst thing in the morning, in the swell. But in terms of pain, is to do with your local anesthetic. There is no pain the next morning when she wakes up, or after the procedure, even when it numbs off. It's just, these are just tiny dots. Now, why do I advocate this procedure? You can see she got a bit of laxity, skin laxity in the corner. You can touch it up the next time she comes in. You can't do that with a surgical blepharoplasty with a knife. I just have you just can't do that. See, she got a little skin fold. If she's not happy with that area, or that area is not done, it just takes you, after anesthetic, it just takes you like 30 seconds to touch it up. So you can tailor make it and design it and do according to the patient's skin laxity. So you don't need a knife. It's a very painful procedure. They don't need to be in the hospital. It's very precise, very accurate, and you can get very good results. So after having said that, the older patient they are, the better results they get, because you take more skin off, they heal faster, and the skin is very thin and is easily removed. So
it seems like so to me it looks like you're doing a couple of different things here. You're causing an injury to the tissue for starters, so the patient can expect some natural healing to occur there. But you're also coagulating the tissue. And by the way, this is also done with the hemo button on your handpiece, so not a cut option. It's done with the hemo option and using the broad needle there. And it's a low power again. So you're on power of 2, 3, 4 on your Surgitron. And you're producing little coagulation dots that almost tighten the skin almost instantly. They just contract the tissue. And so you're getting both a thermal injury to the tissue, which is causing the body to rejuvenate itself, but you're also getting a tightening effect. And depending on the pattern you use, you can actually do these dots all the way up the forehead, and you can try and draw the eye in a particular direction. The image you can see up here is actually, I put it there because a doctor I know watched a session that you and I did last year, Dr. Chan, and we introduced them to this, and they went ahead and did it on a lower lid. And he just sent me his result, and this was his first go trying it on a lower lid. And I think, you can see about a 50% reduction in the eye bag doing this particular procedure once. So, highly effective, simple to do, safe. And if you get your settings right, keep them low, you're really doing a very gentle coagulation of the tissue. So I think I covered settings there. You're about 4 and you're on the hemostasis option. There's actually a paper on this. I can send it to everyone. A doctor presented at IMCAS last year on using the Surgitron for this procedure. He's got a whole clinical article that supports it. So they are anything else on this, Ben?
Yeah, okay. So you can see the coagulation is one thing, and the other one is most important that you touch on is actually shrinkage of the skin. It's a shrinkage that tightens it. Yeah. So previously, how did we do it? We use a CO2 laser, but the CO2 laser again is not as elegant. You can't control the depth, and the CO2 laser is a dot, but you can't really precisely control that, because you can see that's a very tiny area. And I want to mention that you can see that lady after it's being done, it's as if nothing has been done. And that's the beauty of this. You can see, you can actually see the eye lift almost immediately, and the patient's awake, and they can see, oh, I like a little bit here, a little bit here. They can have a lot of guide for you. So sure. The eye bag is an interesting one. I must do more of this one. It's to do with the herniation of the fat from underneath, and because one is herniation and the other one is a skin laxity. So again, you can see this patient's man, the right eye, you're tightening it, and so it's the left one. He can do another repeat treatment. So it's basically pulling the skin back and containing the herniation. That's why it works.
Yeah, excellent.
But I'm not suggesting that you can treat every eye bag. Depends on the severity.
Sure. Okay, so that is called the broad needle, by the way. And then for the excisional blepharoplasty we looked at, that is using the Varatip. So the needle tip where you can actually change the length of the wire at the end. Dr. Chan talked about understanding anatomy and understanding where the muscles are and trying to stay superficial as you need to be. There is actually another tip that you can use in this instance. I'll show it to you now. It's this one here. It's this yellow tip that you can see here. I don't have the name of it. It's called an empire needle, and it's a cone-shaped end. So rather than it being a wire, which can cut really easily, it's got a cone-shaped end, and it's only the tip, the very tip of it, which is super narrow, almost narrower than a needle itself. And so if you want a really superficial cut, if your aim is to do an excision, but for the cut itself to reach a very superficial depth, then an empire needle is a good choice. Okay. So, I mean, we've talked about so much, but I just wanted to recap, Dr. Chan, why did you get a Surgitron? What do you think in summary, are the benefits of using one? And do you recommend it?
Look, this is honestly, if you are doing skin surgery, skin cancer, and so on, this is a must-have tool. If you're going to do cosmetic mole removals, anti-last syringal mask, this is a must-have tool because there's no alternative. And it's a very robust machine. It doesn't break down. It's just a solid state machine. There's no servicing. You think, wow, there's so many tips I've got to learn. Actually, when you get it, you see how simple it is. And I won't worry too much about the power setting either, because you go as low as you can and you just turn it up as you need it. So it's not 5, it's not 6, it's every tissue responds differently. You go low, no response, go higher, higher, higher. It's similar to the way that you work with a bifurcator. So you don't turn it right up to 10, you just turn it up slowly. So it's not complicated. Don't worry about the tips. When you get the machine and you don't know which tip you will learn it within the first case that you do, how each tip behaves. And
or they can call you, right?
Can call me, yeah, they always do, or do our online. Look, it's just a cutting machine. That's all there is. The question is whether you know your medical indications.
Okay, so we talked right at the start about Dr. Ben Chan's Education Institute, and one of the online courses that he has actually on the Surgitron. So way before Dr. Chan and I even met, Dr. Chan included a Surgitron course in his aesthetic education set of modules. So clearly you had you have a fundamental respect for this device, and you feel that it needs to be in an aesthetics clinic, and people need training on it. And there is an online course through the ASI that you can do on the Surgitron. And I include it if required. I include it. There's a lot of people who are happy to get their Surgitron and just go for it. But if you want to, there is an online course that you can do that can give you a bit of a few fundamentals and help you get going. But the learning curve, I think, is quite small. I think once you start using it after a day, you're off and running. It just comes down to changing power and adjusting things depending on the resistance you're getting from the tissue. So I just have one more question. What about skin surface irregularities? I imagine this is to do maybe with this treatment. Are you able to treat other things in this way, Dr. Chan?
I think we covered the most part where this machine is the strongest point, really, and you can't really have a replacement. In skin irregularity, I don't know whether we're referring to pigmentation or like lumps and bumps. There are other tinier machines for those, but probably not these. This is this more aimed for dermatological surgery and very like things like xanthilastoma syringal mask. There's no other way of treating it. So if they want to do skin irregularities, you probably depends on what it means, right? We have different options. But if you don't know what to use, you can PM me or you can message me, and I will tell you. Is this area, like you can see, our online process is so big. This area is so complex, and we are very happy to bring it all to you because it's never before. Most people focus on toxin fillers, and as Christian said, I developed this module because I felt that really skin doctors and cosmetic doctors, they don't know this area. They really should know, because how do you become a cosmetic physician when you don't know how to remove a xanthilastoma? So I prepared all this way before I even met Christian, because to me, it's an essential part of being a cosmetic physician. Look, there's so many things to learn. You'll be blown away when you go to our website. But there are certain things that you just can't treat without this treatment. Without this, if you want to remove moles, you can't do it without this machine. So how do you become a cosmetic physician when you know a little bit of it, a little bit of that? You're not whole.
Yeah. Thanks, guys. Thanks, everyone who's tuned in today. All of my wonderful clients who own Surgitrons, who have jumped on board here to learn some more about their systems. Thank you very much for doing so. If you're someone who's jumped on here to explore the Surgitron, I'd be happy to talk to you about how you can integrate it into your clinic. All you need to do is just type yes or something, or give me a call into the chat box, and I'll give you a call and have a chat about that. Dr. Chan, thanks again. Dr. Chan and I have worked together for about 4 years. We've delivered a lot of live education on various aesthetic topics over the years, and we'll continue to do so next year, I imagine, when we can get back into the live space. But I think for now, this is a really good forum, and we've tweaked it a lot since doing passive webinars to doing these sort of more interactive Q&A based sessions. So we'll continue to do these. I think, Dr. Chan, I'll probably invite you to do an RF microneedling virtual workshop with me soon. So we will continue to bring you more sessions like this, more devices to look at, more treatments for your aesthetic business. So thank you. And of course, thank you, Dr. Ben Chan. Thank you very much.
Can I just add one more last bit there? This morning,
Sure.
I just did an intro on the how to start up a skin clinic, right? It's going to be a series of my introduction on how to start a skin clinic, gradually moving to skincare, how you use skincare, use is nothing you've heard before. And essential part of the equipment is you talk about microneedling. Why I think about microneedling, I will do a module on that. Why every skin clinic should, I'm talking about cosmetic clinic now, I'm not talking about dermatological clinic. Why you should use microneedling RF. The other one is IPO. Why do you do that? These are almost an essential package, like a basic package, foundation package, how you do that. So stay tuned.
Stay tuned. The invite's coming your way soon. So thank you everyone for joining us. Thank you, Dr. Ben Chan. Have a wonderful day, everyone. Until next time.